All this is Dr. Mobeen Sayed from drbeen.com. Today we have an excellent guest with us. I hope and I wish that she can be with us every month, once or twice, because she is a nutritionist as well. So that is something that we nowadays, especially, we need these topics a lot. So we are blessed to have her with us. A quick introduction for Dr. Shubhashri Ray. She is a clinical and public health nutritionist with specialization in ketogenic diet and childhood epilepsy. Both of these are great areas. So I am so blessed that she is with us. Ray has 10 years of experience in various fields of nutrition, including micronutrients, lifestyle disorders, medical nutrition and therapy, etc. She is the recipient of Young Researcher Award for her work in HIV and probiotics. Check that out, probiotics. I am a fan of probiotics, so it is great to have her. So many reasons that I'm so happy to have her with us. Also, she has received Women Leadership Award in 2018. Dr. Shubhashri Ray, welcome.
Thank you very much, Dr. Bean. So it's a pleasure to be here with you, considering your show is so popular, and then I'm also a fan of it. So it's a pleasure, and good morning, everyone. This is Dr. A. So I am basically someone from clinical nutrition background who has worked with diseases and wellness and basically lifestyle disorders. So my current area of work is diabetes and hypertension and other lifestyle disorders and their clinical management with nutrition. I believe in food as medicine. So if you go to my LinkedIn profile or my Twitter profile, so you will see that all the time I'm speaking about wellness and nutrition and how to adopt nutrition as a mode of lifestyle intervention and not take a lot of medicines. So that is which is my major focus area. Also, I'm in this current time, I'm totally invested in COVID-19 education and provide some easy learning like you do, Dr. Bean. But yes, in my own way. But yes, I mean, so this is what I'm doing currently. I'm a great fan of micronutrients, specifically all the vitamins and minerals which we need, but we don't take in general. And I see that people are, they're not cautious. They don't really know that what they're eating and what should they actually their value should be. So they don't know that, and so their intake is also not up to that. So yes, thank you very much for having me today.
You are very welcome. So we are about 1 million cool beans. Right now, we are watching you from Facebook, 2 of the Facebook channels and YouTube. So from all of us, thank you very much for being here. I am really a fan of good nutritional or nutrition-based health. So thank you very much. I think we're going to really take advantage of your presence here. Today, we're going to talk more about the vitamin D. That is an area which is near and dear to my heart. And I see your tweets about it as well. And it looks like you are very much inspired by the correct, dosages and correct amounts of vitamin D and the health. So if you're ready, should we start our questions?
Yeah. Please go ahead.
Absolutely. So for the cool beans here, our context for the discussion today is vitamin D, Indian population, and then COVID-19. So these are the 3 primary topics in which we're going to wrap our questions. And if you have any questions, the structure is going to be that first I'm going to have some questions that we had decided. Then we'll look at Twitter as well. And if you have any question during the discussion in the live commentary, please put the word question or Q or something that we can identify the question from there. So Dr. Ray, let's start. So the very first question, what is the prevalence of vitamin D in Indian population?
There are different studies and different percentages, but in my opinion, or what we are seeing currently, like in my own practice also, so the prevalence is actually ranging from 40% to 99%, and it is prevalent in all age group and all high risk group specifically. But if you tell me, so the prevalence actually lies between 70% to 90% somewhere. So it's not less than 70%. So the recent study last year from Mumbai, what we have seen is that the prevalence is almost 77% in 4,000 sample size. So the prevalence is very high in Indian population, considering, I mean, that can be, so we have good sun, we have good sun and we have a lot of exposure to it, but still we do not have the required amount of vitamin D, what we need. So the prevalence goes from 60%, 70% on an average, I would say, what we have actually experienced in different studies. So
So,
that
so
is
can we, got it. So can we say then that there are about 30 to 40% of the people in India who may not have the correct dose of correct amount of vitamin D in them?
yeah, but 30 to 40% is less, doctor. So I would say that we almost more than 60%, more than
Okay, so
60%. So wherever, yeah, wherever, I'm seeing,
so 60,
like people,
70% is the deficiency.
that is the deficiency. That is
Oh
the
wow.
deficiency.
Oh wow.
Yeah,
That
it's a
is
lot.
huge.
It's a lot. Yes, 70%. I mean, 60 to
Oh
70%
wow.
people are vitamin D deficient. I mean, if you search literature also, so the biggest review, like what is published, which is published like last year, maybe last to last year. So it has all the studies from like hospitalization patient from community. So they have jotted down that the prevalence is from 40% to 99%, but
Hmm.
on an average, it's 60 to 70%. I mean, if we see
Got
the
it.
bracket, so yes,
Got
I
it.
mean it's very very common
So
in India.
I'm gonna add a question before we talk about the vitamin D and its role in the immune system. Can I ask you, as a nutritionist, what is the reason for vitamin D deficiency? You have lots of sun there. Why are
Right.
people still deficient in vitamin D?
I would suggest, I would what my recommendation currently is that even if we have sun, but we really don't know that how much time we need to be exposed there and what kind of sun we need. I mean, not like entire day you cannot get sun and synthesize vitamin D in our skin, right? So you need a particular time, like 7 to 10 a.m. in the morning, and you need to at least stay there for 15 to 30 minutes. So these are not particularly in practice. And second, the diet, because vitamin D alone cannot be actually synthesized in our body. So we need a lot of other minerals like magnesium, so magnesium and calcium. So all these are synergistic, right? So we are not eating good amount of vitamin D contained food items also. I mean, so most of the people in India are vegetarian, and they don't have a regular practice of eating dairy or fatty fish. So this is not there. So that is the major reason. Even we have a lot prevalence of osteoporosis also in post-menopausal state and other issues. So I think diet and not knowing that how much sun is needed and when the sun is needed are the two most important factors in India that we are this prevalent.
Got it, got it. And just for
Yeah.
the cool beans, Dr. Shubhashri Ray has joined us at 6:30 a.m. her time. So it is 6 o'clock p.m. in California and 9 on the Eastern Coast in the US, but it is 6:30 a.m. So thank you very much for taking out the time and waking up so early to talk with us. So the next question I have is, what is the role of vitamin D in our immune system?
So during COVID time, so we are talking so much about immunity. So before I go to vitamin D, so everything is tagged as immunity booster, right? So that is something which has become so famous now that we are saying that okay, you eat this and you will become like you will have better immunity. So that is false, right? So we don't really get immunity overnight. That is number one, and it's like not one food that can give us immunity. So we need cumulative so we need food, we need good sleep, we need sound mental health, we need physical activity. So everything is needed for immunity. Now vitamin D, when we talk about, so vitamin D cholecalciferol particularly, the form of vitamin D, which is actually very important for bone expression of immune cells, particularly T cells and B cells and antigen presenting and like cells. So these are the cells which are actually not be able to process, or I can say not be able to be able to actually regulate in absence of vitamin D. So vitamin D can actually modulate both innate and adaptive immunity. So it's very, very important. There are mechanism of actions are different. So I'm not getting into that kind of detail because you have already covered so I've seen your lecture. So vitamin D is very widely covered. So only thing what we need to understand is that vitamin D is indispensable when it comes to both innate and adaptive immunity, which is very important in when we are actually dealing with pathogens.
Got
So that's what.
Got it. So correct functioning of the immune system, correct balance of the immune system, vitamin D is very important. So tell me this, Shubhasree Ray, uh, how about the respiratory? So nowadays we're talking about COVID-19 and the respiratory system and the illness. So how about the respiratory system health? Does vitamin D play a role there as well?
Yes, so they maybe 3, 4 days back, I was studying and I had written a thread on that. So what I found when I was researching, because so vitamin D has a wide role, in inhibiting like pulmonary inflammation, because there are two kind of roles. So number one, when vitamin D is actually boosting your immunity. I mean, if we say the word boosting, and it's very crucial for your innate and adaptive immunity. So with that, vitamin D is very, very important to reduce the pulmonary inflammation. So this is some micronutrient which will actually block the microorganized organisms or pathogens at the first place. It will not be allowing the pathogens to get inside. So we have seen that in clinical trials. So when the vitamin D supplementation is given to the patients, so their respiratory health, like deterioration in respiratory health, were much lesser than people who didn't take that. Even in COVID-19, the studies, what we are seeing, there are now more than 10 publications, right? So everywhere, people who have succumbed to death or who have uh, advanced to severity, they had vitamin D deficiency in their system. So there is definitely a causal relationship. Uh, so uh, People are saying that no, there is no RCT as usual, and there is no proof to that. But I believe that definitely there will be an association, which we are not looking into that data, very frankly speaking. So yes, for the inflammation to go, it's very important. Pulmonary inflammation, vitamin D is very important. That's what is established literature so far.
Got it. Got it. So tell me this. So, of course, nowadays, once again, in the COVID-19 context, we are concerned that we will get COVID-19, and if we'll get it, we'll get sick, and who knows who will become severely ill. So, how do I know my vitamin D levels are accurate? How do we find out if I'm deficient or not?
Yes, so I really recommend everyone for regular assessment of blood test. So we need to keep on checking our serum level. And basis that we need to take like dosage from the physician. We have to go to a physician and ask the physician that this is my vitamin D level and I need vitamin D for that. But there are certain risk factor for vitamin D deficiency. So if I'm having dark skin, I'm an elderly, I am not eating much fish, like in or dairy in my diet. I'm not, I'm living far from equator where we don't have much sun, and always, we are wearing sunscreen when we are going out and staying indoor for most of the time. Even in India, also see our office setup is also mostly closed now. So we have AC, we don't want to go out. So in this condition, if we know that we are living more in like indoor, we don't have a dietary habit, we are having dairy and fish and being overweight and obese. Yeah, that is a very important point, because overweight, obesity and vitamin D have intricate relationships. So you have vitamin D deficiency, You can be obese, you are obese, so you can have vitamin D deficiency as well. So with these conditions, we know that these are maybe certain risk factors. And with that, if we have signs and symptoms such as I'm getting sick more often because my immunity system is compromised, I'm fatigued, I'm tired, I have bone and back pain, I have depression because vitamin D is crucial to release like hormone called serotonin. So serotonin has major role in actually our mood. And impaired wound healing. If we see that my wound is not healing for a very long time, and hair loss, bone loss, so these are the certain symptoms and the condition risk factors we are living. So we know that we are maybe having vitamin D deficiency in our body.
Very, very interesting. Very interesting. If I think about it, what you're saying is that not only just going to the labs and getting the vitamin D levels is important, but if you are living in certain ways, or if you experience certain symptoms, you might become suspicious that I may have vitamin D deficiency. So very, very
Right.
interesting. Thank you very much for this. So tell me this, that should everyone take vitamin D supplements?
I would say yes, because we can't get enough from diet. I mean, that's not possible. Vitamin D is the only vitamin which can't be getting from dietary sources. So it gets it at some extent, definitely. I mean, diet will give some extent, but it's not possible to get enough, or maybe the recommended dietary allowance, DA level, from diet alone. So sunlight is also needed. Now, considering that we are not utilizing sunlight better, that's why the deficiency is so high, the prevalence is so high. So I would recommend that yes, a safe supplementation would be better, but we need to know the dosage as per body weight. We need to know the dosage from the doctor, and then we can have that in our daily diet. I mean that sorry, including our daily diet. So supplementation is, I mean, everyone needs
It
that,
is
but if
recommended.
that person has deficiency, yeah.
Definitely. Got it.
Yeah,
And there was
yeah.
a question, I just wanted to quickly connect that. JTJ had said 75 nanomole per milliliter is the minimum. So look, the correct. So it is per milliliter. There are variations in this discussion. Some folks say that 30 to 50 nanomole per milliliter is adequate. We know that lesser than 12 is called deficiency, but 20 to 40 or 30 to 50. So somebody had asked this question of 70 or 75. That is definitely correct. So sorry, a sidetracked question over
Um,
here. Uh, the next question is that our main concern with COVID-19, if it was just flu, that will arrive in our body, will catch flu, will be sick for a few days and be okay, that would have been
hmm.
different. But what we're seeing with COVID-19 is that it is aggressive. One, it progresses very rapidly, and secondly, in some people, it can actually cause a cytokine storm and kill them even. So what is the role of vitamin D? If somebody is taking vitamin D or somebody's levels are correct, does that help at all with the cytokine storm?
Yes, I have really, so when I was reading about vitamin D and immunity particularly, so why it's important in cytokine storm, because cytokine storm basically surge a very huge tide of like immunity, like immune cells against our own immune system, like, right? So it's a more of autoimmune process. So if our immunity system is better already, in the adaptive and innate both are working in a better manner, so I think there from the beginning, from the root, the cause is coming. So this is my understanding, because not much research is available, only a short review is available in that, but we can connect the dots. We know that, so if the immune system is actually well balanced, and so we will not have the autoimmunity against us, our own system, right? So vitamin D plays a very important part to suppress the cytokine storm by modulating the autoimmunity, which is happening. That's what is, again, I mean, we don't have established research yet, right? So we don't know the mechanism of action correctly, but yes, the hypothesis, or maybe the medical explanation can be this is what is my understanding.
Got it. Got it.
Yeah.
And we have been, for the cool beans here, we've been talking about vitamin D for some time. It is very important to keep and Dr. Ray, we use the word optimal instead of boosted immunity. And we say
Yes,
that it is important to keep our immune system in balance or in an optimal state where it does not hurt us as well. Plus, it also takes care of the pathogen too. And vitamin
correct.
D is, as you're saying, is paramount to keep that. So tell me this. Is it all, and I think about this question a lot as well, because we've talked about on Dr. Bean show, we've talked about vitamin C and vitamin D and vitamin K and magnesium and zinc and many other things. So is vitamin D by itself sufficient, or other nutritional aspects and nutrients should be looked at as well, especially in the context of COVID and general health?
Right. I will answer that in two parts. If we talk about vitamin D, so the vitamin will be working uh, better if we have manganese and vitamin K2 and calcium definitely so with us. Now, during in lot of animal and human studies, what we have seen that optimal concentration in both vitamin D and K are beneficial for bone and cardiovascular health as well. So that can be, so we have seen that in genetic and molecular and human studies. So most clinical trial would they have shown that in post menopausal women particularly, so when you have vitamin K and vitamin D together, so we have seen a better result in bone health. So this is what my understanding, that for the vitamin D to function, calcium and K2 is very, very important. This is one. But if we are not looking at only vitamin D, but as a whole for COVID-19, it's very important that we are looking at a holistic nutrition aspect. I never recommend a particular nutrient, and I do not think that only a single nutrient would be beneficial, because we need total nutrition with us. So protein is also important. If you are protein energy malnourished, so you will not have enough support for, from your body to actually fight the infection. At the same time, zinc, the paramount importance of zinc, during COVID-19. So zinc, selenium, and definitely iron. So all these are very, very potential micronutrient which has particular function in so many areas. So these are also important, and I think we need to make sure that we have all these nutrients in our diet and not only a particular. Definitely, vitamin D is very important because it has wide variation of lot of importance. But a total diet will help in managing the health system in a synergistic way. So that is what which is my recommendation.
Got it. Got it. And just a quick plug for the cool beans here. If you look at the YouTube videos that we have done, I have done a video called a food plate for a healthy immune system, in which we try to collect all various nutrients that are needed and what foods may have them. So it may be useful to actually refer to that video as well. So I want to ask you a very critical question, a very important question, especially in the US. It is even more important. I do not know what is the obesity level in India. We know that we have an epidemic of obesity in the US, and in other countries, the comorbidities for COVID-19 do not have obesity at a very high level, meaning top comorbidities are, for example, diabetes or cardiovascular diseases and so on. In the US, the second top comorbidity that is causing people to have severe disease is obesity. So what is the role of vitamin D, and how do we see that in obese folks?
So obesity and vitamin D, actually they are related. I mean, obesity, that is an integrated relationship. So if you are obese, so there are two types of relationships. So even yesterday only I have written a thread on that. I mean, that is like on obesity and vitamin D. So what I have found from research is, if you are obese, then there are multiple reasons. So mechanism of action is still not clear, but what we understood is that obesity actually suppresses your synthesis, vitamin D synthesis in your body. That is number one. If you're obese, there are different hormones which are not in like you have lack of that hormone, or maybe you are, you are not metabolizing that properly, so those hormones are not there, so you are actually becoming obese. If you are vitamin D deficient, then these are, so you will become obese. So that is what we have seen, like in men, there are studies that when vitamin D is deficient, so men don't actually release enough testosterone. So there are 3 4 studies which I have studied, like, yesterday I have studied, and I have also written that. So it's very important that testosterone is very important for like maintaining the body fat, adipose tissue accumulation also in men's, like in men. So this is which is when you have vitamin D deficiency, so you will become obese. Now this is also, the relationship is also vice versa. So if you are obese, then you are having vitamin D deficiency as well, because a theory is a obese person does not go out more often. There are a lot of reasons, so they are not exposed much. So there are 2 studies. What has been shown is that when they have, even body size also matter. So if you are obese, so you need more vitamin D. That's what I found out. So what happened when you are actually correcting the level by supplementation, then there is no difference in level in obese and non-obese patients. That's have been proven by 2 RCTs. So there are more than 15 studies which are actually supporting that vitamin D and obesity are actually related. Vitamin D and diabetes, all the metabolic disorders. I mean, if you are obese because you don't have vitamin D, enough vitamin D in your body, so obesity is related to diabetes and hypertension and etc. So obesity is the major cause for all the metabolic disorders, right? So this is which is a relationship with obesity and vitamin D. So it's really important. I mean, yesterday even I also explored a lot. I did not know so much about it.
Got it. Got it. So tell me, in India, is there any study for vitamin D deficiency relate and then the COVID-19 severity? Any link that have been seen in Indian population?
I'm very sorry to say, doctor, but yes, we did not show such studies yet. Maybe we are conducting, but the results are not yet out. I'm also looking out for that data, because every day India is seeing 900 on an average deaths every day.
Hmm.
So we are trying to understand, even I'm very much interested to understand that what is the percentage of vitamin D deficiency. Number one, whether there is an association. If there is an association, then what is the prevalence of that? So we really don't have that data, and I'm very much interested to see that. And we really need to understand. In fact, I will start writing to, like, by my tweets, of course, and that we don't have much option to actually appeal to the government, so state government and national government, to start vitamin D screening. What I know from personal level is that there are certain hospitals, there are certain establishments which are who are actually doing the screening on their own. I'm not sure that if that is part of our national protocol. So I need to. I mean, I will just tell. I want to tell our government that please start doing the screening and see that if a person is having vitamin D deficiency, if that person is vitamin D deficient, then that deficiency needs to be corrected first. We really don't know that the people who are actually becoming severely ill, whether that is related to vitamin D deficiency, because now the establishment, like immunity and metabolic disorders, so everything is actually established. So no, very sadly, we are not looking at that data. So
Got it.
globally, we are having so many data, but yes,
Got it.
in
Yes,
India, we don't
exactly.
have. Yeah.
Got it. Got it. And just a side question here, M. Gregory is asking that question on the live as well. And that is that what is the percentage of obese folks in India? Do we have that data available?
What is the percentage of? Please.
What is the obesity's prevalence in
Oh
India?
yeah. So obesity, yeah, we are also having 25%, 15 to 25% people, and
Obese.
Like that depends. I mean, sector
Got it.
to sector it depends, but 15 to 20%. Yeah.
Got it. Got it. Very good. So let me do this. Usually I go to the Twitter questions. I'm going to take a few of the questions that are coming in from the live feed, and then we'll go to Twitter as well. And please feel free that if some question is not within the context, then feel free to pass on it. So there is a question from James Kelly. So I'm going to read it. The question is, how much vitamin D3 does Dr. So I'm going to put it up for you to read it as well. I know it is covering our faces now, but so
Yeah.
how much vitamin D3 does Dr. Shubhashri take daily? Part two, how much vitamin D3 does she give or recommend to a recently admitted patient with serious COVID-19 who has tested deficient?
Okay, so James, I would like to answer this as that I am not a practicing doctor, and I do not really recommend dosage because that's not my domain. So my recommendation here would be that first we need to assess the level of vitamin D what you are actually having currently, and after that I would recommend that you should go and take a supplementation dosage from a doctor, from a physician who will know better that how much to be given and what form of vitamin D you need. So I really do not recommend dosage or brand
Got
because
it.
I'm a doctorate, I'm not a practicing doctor. Yeah.
Got it. So just a very quick note from my side here. Look, if I look at the books back here, they say that the daily RDA is anywhere from 400 to 800 international units daily. Mayo Clinic says 600 RDA is 600 international units. During the COVID, when I see some patients who are COVID, for example, yesterday I started looking at a family who all of them, I think 5 members, they started having the COVID symptoms. I give them 5,000 international units on daily basis for at least 5-6 days. It is pretty tolerable even in the high doses. I have seen doctors giving even higher doses, but 1,000 to 2,000 international units are generally for a healthy person, adult, are safe. So let's continue with our discussion. I'm going to share my screen and show some of the Twitter questions. So before those questions, Cool Beans, here is Dr. Shubhashri Ray's LinkedIn profile. So definitely very active on LinkedIn. And I believe, Dr. Shubhashri, if this is correct, I've seen some of your tweets trending as well. So I would definitely recommend people to follow her. So now let's look at the questions that Cool Beans have submitted. So Rajul says, what is the relation between vitamin A and D? Is there any ratio that should be maintained between vitamin A and D?
Well, I vitamin A and D not so much related. I would say the relationship is more with vitamin K2. Vitamin A is another important vitamin which needs to be assessed. I mean, need to be taken separately. The ratio, I don't like to recommend that way because nothing is calculated. Vitamin D is very important to be taken in a dosage, and vitamin A also in the recommended dietary allowance. Both the vitamins needs to be taken daily via green leafy vegetable and other sources. I mean, so we have carrot and we have all the yellow and orange vegetables for vitamin A. So there is not much association in this one, but I need to really look more into it, and then we can have like maybe there are some association, but as of now we prefer to associate vitamin D with vitamin K2. That is what which is more important than maybe vitamin A and D together. But separately, both the vitamins we have to take, irrespective of their association or no.
Got it. So a very quick comment I'm going to make for Sina Strebchuk. I'm sorry if I did not pronounce correctly. When I asked about supplements, my doctor says that the most supplements are not absorbed. That is paying for very expensive yellow urine. So the truth is somewhere in the middle. There is a question here as well on the feed here that vitamin D is a fat soluble vitamin. So to remember the vitamins that are fat soluble, we used to have a mnemonic that was CAT is on the ADEK and ADEK. So these are the fat soluble vitamins. They can be stored in the body as well. And number two, look, if I am deficient in a vitamin and I eat food or take supplement, it is going to be used up. It is going to be taken up. So this is not necessarily true that if I take vitamins or supplements, they would be wasted. Yes, if there is extra amount of some supplement that our body is already okay with, the dose is correct, then the body is not going to use it. It's going to throw it away. In some cases, for example, fat soluble vitamins, they can be stored as well. So the general comment that it makes very expensive urine is not correct. It depends upon a person's state. And nowadays, I think just to be in the safe side, we should take supplements. All right, so let's continue with the further discussion. So covid.us.org says, would India benefit from Sunshine on Skin public information campaign to raise vitamin D levels across the population, especially for those who cannot access vitamin D supplementation? Can the custom of women keeping covered be overcome for such a program, ratio of benefit to cost?
Yes, I would say yes. First of all, I believe that national government should start a vitamin D prophylaxis program. Considering the current situation, that's my opinion, personal opinion. Like in India, we have vitamin A supplementation program. So that's a national supplementation program actually. So SNP we say. So that is something which is really important for our country right now. Second thing, if somebody is not able to afford the supplementation, I believe if they are getting enough sun, like the morning sun, of course, I mean 7 to 10 a.m. and 30 minutes, and also taking good diet, right? So this can be I would not say 100% it can be managed, but can be managed to some extent. But if we are practicing it for very long, maybe not the severity of deficiency will not be very high, like we see in if we are not taking supplementation. But in COVID time, like you said, doctor, I would really, I would like to be resonate on the same line that it's important that during this time we are taking supplementation, because food or sunlight cannot do it overnight. Like I have already told you that it's difficult to get that kind of compensate. I mean, we can't compensate that level in a day. So in COVID time, it's very important that we are focusing a bit on supplementation, but for longer period of time, diet and sunlight would be a longer solution. That's what is my recommendation.
Got it. I think that's a very important point, that these are exceptional times, and in these times, we cannot behave as we behave in a routine, general, regular time. So Roshan here has two questions. Number one, how much daily sunlight in India at say 8 to 8 a.m. will be enough to get required vitamin D? And I just heard your answer for that as well. If you like, you can shed light on that once more. Yes.
Yeah, Roshan. So as I told that in India, I mean, our sun 7 to 9 a.m., 7 to 10 is also okay. So you need to at least spend 15 to 30 minutes in that sun. So then you will get, enough kind of, like you can synthesize enough kind of vitamin D on the skin. So that is number one. And the second one,
So tell me this, before we move on from the sunlight, this is important, that sunlight on how much part of the body is. So normally in our cultures, we are covered, as covid.us.org said as well. So is the sunlight on the face and hands for 15-30 minutes enough, or what is the surface area that should be exposed?
Oh, surface area, yes, that is very important. I missed that. So yes, I mean, we need to have maximum exposure. So I would say that in a balcony, I mean, in India, so that's a problem. So in India, it's very difficult that you are actually you can't expose much to the sun because of the culture as well. I mean, I'm very frank about this. So we can't really, like we see in beaches where people go and can have take a nice sun bath. It's practically impossible in India. I mean, we don't have such kind of. So that's why I recommend, particularly for women in our country, that they can have a short dress and can stand in the balcony where nice sunlight is coming. So yes, we need a night, sufficient surface area to be exposed. It's not only the face or the hand will actually do it. Yeah.
And that actually makes the supplements even more important. So,
Yes, for India, of course. Huh.
right. So then the next part of the question here, for proper working of vitamin D, are other minerals like magnesium necessary, and what foods are important to take?
Yes, so magnesium is important, like we said. So magnesium can be obtained from all the, like dairy has some, and also fish and egg and beans, also legumes. So these contain magnesium. So we can have magnesium from all this food, and all the time. I mean, every time I speak, so I say if you are combining a holistic diet plate, which will have vegetables and fruits and dairy and fats and oils, nuts and beans. So these combination will actually give us the kind of nutrition we are looking at.
Got
So
it.
yes, magnesium is important, and we can get from these foods. Yeah.
Got it. So the next part of the question from Roshan is, it is said that in old age, skin cannot make adequate vitamin D from sunlight. So what would be the typical supplement taken? So this is, first, I think if we can confirm from you, is this a correct assumption that the old age skin cannot help make enough vitamin D?
I'm very sorry, doctor, but I don't have that idea. I mean, I've never read that old age cannot synthesize, so I really don't know that if that's possible. But yes, I mean, as we see, osteoporosis is definitely prevalent in older people, but that has different mechanism, biochemical mechanism, and not only just synthesis of like vitamin D from the skin. So I would not be able to, give you a very certain answer for that. But irrespective of age, I mean, I think vitamin D supplementation needs to be taken, because as I told you, even for the adults, I mean, not everyone can synthesize the kind of amount we require for our body. So for old age, based on the person's level, so I think the supplementation would be better. Always vitamin D needs to be supplemented, because we cannot get it, like obtain it from diet, and sunlight is not always an option for us. So that's what old age, young age, I mean, we need to take supplementation of vitamin D with permission, with from a doctor,
Got
from a
it.
doctor like you,
So,
a physician. Yeah.
so I'm going to look at one of the questions from the feed as well. Yayati Lambhate says, is eating daily one egg gives enough vitamin D?
No, no,
Yeah.
that's not, that can't be possible. One egg doesn't have enough vitamin D that will actually fulfill your requirement. Like doctor said, right, that 1,000 to 2,000 is
Yeah.
actually, 1,000 is pretty safe dose which we are recommending. During COVID time, it's even more important. So 1,000 international unit cannot be obtained from a single egg every
Yeah.
day,
So one
and
egg
it's
yolk.
not.
Yeah. Sorry, please. Sorry.
Yes. No, yeah. So, and it's not only if we are eating the entire uh, amount of vitamin D what an egg has, it will not be biologically available. We need to understand very important thing. Food, whatever we are eating, if we think that 100% of the nutrients which are available would be biologically available to us also. What is biological available? Meaning after absorption, the entire nutrients what you are eating will be actually utilized by your body. So it doesn't happen that way, that 100% we are utilizing it. That's why we require supplementation for certain nutrients.
And just
Yeah.
to add, thank you very
Yes.
much, Dr. Shubhashri. Just to add, one egg has anywhere from 30 to 40 international units of vitamin D. That is if the chicken is exposed to sun correctly and the feed has the correct nutrients from which vitamin D can be made in the yolk. So 40 units of international unit in one yolk. And imagine if you want to take 1,000. So there'll be tons of eggs you'll have to eat every day. I love eggs, so you can send me tons of eggs and I'll eat them. But I think supplementation becomes important. So here is a question from Dr. Venkatesh Jawal Gekar. Would like to hear more about spread in Indian metro cities and how much percentage of population is actually. So I think we can probably skip this question. This is more about the COVID-19 spread.
Yeah, yeah.
I'm going to continue here. And Dr. Joel Gekar, please don't be upset. We are talking more in context of vitamin D. Here is another question. So this is about ketogenic diet. If you're okay, I'm going to skip this question as well. And Ronald, please don't mind. We'll stay focused on
We'll have
vitamin
to
D
see
today.
this question. I have seen this question, Ronald, but I need to do some research, and I'm very sorry that with work, I did not get much time for that. But we will definitely get back to you. I think Dr. Bean would be answering
We will
here
invite
in
you back
this.
again for ketogenic diet. How about that?
Yeah.
We'll
So
talk about ketogenic diet. I am very much interested in hearing more
yeah,
about
yeah,
that.
that we will do later. Yeah, I mean that's a very different subject, and we need entire
Yeah,
session for that.
yeah, yeah. So, courtesy of Ronald, we'll request you once again to come back and talk about ketogenic diets. Sri Khan says, what will be the approximate duration within which we can hike vitamin D levels by standing in sunlight? I think this is a question that we have discussed multiple times now.
Multiple times. Yeah.
Frank Kushner says, is there a need for another natural to take better absorption of vitamin D3 supplement? Another natural. I didn't
I
catch the
I
question.
also did not understand the question. I think he's trying to say that whether we need anything else to make vitamin D3
Hmm.
absorbable. Maybe.
Possibly. So
Yeah.
these are the questions that are on Twitter. Once again, here is Dr. Shubhashri Ray's Twitter account, and please do follow her. I'm going to now go to the question stream that is from the live folks over here, live comments. So let's start. And again, I'm going to try to keep us focused at vitamin D. So I hope that will be okay. So back here. So there is a very interesting question, slightly away from COVID, but still related to
Yeah.
vitamin D. So Chantal says, do people who have epilepsy or who are epilepsy sufferers and are also vitamin D deficient increase the risk of having seizures?
Okay, Sharon, we did not explore that relationship, and I will tell you because I'm a researcher in ketogenic diet. So it feels good that I'm back to my subject. So since 1980, we did not really look into that data that vitamin D is directly associated with your seizure frequency. It's not until like what I know, I mean how much I know as per existing literature, vitamin D is not associated with your increased seizure frequency. It's more of your brain where your signalings are not going properly. It's very complex neurology. So vitamin D is not associated with seizure frequency, but ketogenic diet is extremely helpful where the medicines are not working in epilepsy. So we call those uncontrolled or pharmacoresistant epilepsy. We will talk that later. And when I come back for that discussion, maybe I will also look into the vitamin D side of it. So
Got it.
yeah.
Got it. So a quick question from Debbie Boss. Which test do you advise? My doctor runs 25 hydroxy D versus 125 hydroxy D. 1,25 hydroxy D. I
Yeah,
think
yeah.
that both of those tests are okay. I'm going to look at more. So Debbie, good question. Thank you. Guru. So Guru Gill says, question, Dr. Ray and Dr. Sayed, have you looked into genetics and vitamin D relationships, particularly VDR, vitamin D receptors, NSPs, or short nuclear proteins? Thanks.
Yeah, I really did not. Guru, that's a fantastic question. I don't know if Dr. Bean could answer that, but I
I
did
am
not
gonna,
really.
yeah. So there are relationships, and these are important relationships. So that means there are genetic predispositions as well. I'm gonna skip that part here. We can do that discussion at a later time as well, because I want to keep my focus at Dr. Shubhashri Ray today. Then let me just. I'm sorry. I'm looking through the questions to see what are other questions here. So there is a comment by Sena Straybuck. Canadian, no problem with skin exposure. Nobody cares. It's the 40 weather and the short days that are a problem. We need a supplement. That is correct.
Yes.
Um, when they had done a study for the Spanish flu, I believe in 1918, at that time, there was a study done in the US where they said that all those areas of US that had proper sunlight, they had less prevalence and incidence of the Spanish flu, and those where there was less sunlight and less vitamin D as a result had more incidence of the uh, Spanish flu. All right, so sorry, I'm looking at the. So here is a good question, Diversity Love. US and Europe have far more chemicals in food system. Is it possible that it impacts health and metabolism? Question, how do we detox our body so that these vitamins are useful? This is a great
Okay,
question
great.
for a nutritionist.
Very, very good question. I mean, I really want to speak a lot about processed food, adulteration, and synthetic food, So detoxification, I would recommend that focus more on eating a lot of fruits and vegetables, the natural one, of course. And smoothie, like morning, mix, if you are having kale and lettuce, and you can have a nice, with orange. So if you are making the smoothie, I generally recommend less apple, because the covering of, like, so to make it more attractive, they always use wax and all on apple. So vitamin orange and pineapple and maybe any green leafy vegetable, so those can be used to make a nice smoothie and have in the morning. For detoxification, I also recommend lemon water. And if you also like lot of water, I mean, you can have a lot of water, in our body, so to detoxify yourself, because all the toxins will go away when you are having a lot of water. And also fresh fruit juices at home. Do not buy and have it like the synthetic one, the canned one. Say no to cold drinks completely, because these are only empty sugar and nothing else. So this way we can do that. So, and also, bacon and a lot of red meat and fried, so this has to be limited. Focus more on complete diet, like beans and legumes and whole grains, which will give you more nutrients. Yeah.
Got it. So one last question, and once again, before that question, thank you very much for coming in. Thank you from all of the cool beans, and we would
Thank
definitely
you.
love to have you back here for the ketogenic diets. I myself am very much interested in that topic as well. So here is a question. No vitamin D supplements are already an activated form. Oh, sorry, do vitamin D supplements already in an activated form of vitamin D, or do we still need sunlight exposure in order to activate them? So do I
Well,
take vitamin D, supplement pill and then go out and stand in the sun, or is that sufficient?
no, taking the supplementation is sufficient, because that is what the supplementation is all about. So the dosage is important, right? So a supplementation will have 5,000 IU. That is sufficient for you. So why we go to sunlight? Because we need to synthesize that, so we go to the sunlight. So when we are getting it from supplementation, we don't need to go to sunlight after taking supplementation. But going to sunlight is a nice habit. So even if you are taking supplementation, maybe this habit is something which will help you for a better lifestyle. So I always focus more on long-term solution rather than just, a short-term. So I would say that make it a habit, but it's not necessary. I mean, if you ask me that whether you should go out to the sun after taking supplementation, no, that's not needed. Right, doctor.
Got it. Got it. Yes, I agree with that. So I had said that last question was the last question. So here is one bonus question, and then we'll be wrapping up. So Guru says, is there any substantial data to support vitamin D toxicity and kidney damage?
Yes, not only kidney. Now here, very, very important question, Guru, and I really thank you, because we always talk about supplementation, but we need to really speak about hypervitaminosis or the toxicity as well, because these are also important. So many people I have seen that they don't really know their level, they don't know their serum level, and they just go to they just buy it and they just have it just like that because they somewhere read or maybe listen to someone that supplementation is needed. But that's why we are reiterating all the time that you need to go to a doctor and understand your dosage, whether you need it or no. So not only kidney, but hypervitaminosis can have a lot of like effect on the body. So you will feel dizzy, you will have fatigue, and there are certain, so every vitamin hypervitaminosis has different kind of expression in the body. So yes, I mean, I would say that do not take a lot of vitamin D or any vitamin in that manner. Supplementation is to be taken by recommendation and in correct dosage. So
Got it.
yes, I would say, yeah.
Got it. So, Dr. Shubhashri, thank you very much from me and from all the Cool Beans. This was one of the very important topics that we have discussed. And if I can request you, if you can make time, we are ready to change some of our time here to adjust with your time because this is right in the morning. If you can talk about number one, ketogenic diets, and number two, detoxification as separate topics, I think Cool Beans would really like to, they would take benefit from that.
I would do that. I would love to do that because ketogenic diet is not much discussed in epilepsy or Alzheimer's. So I've done research in Alzheimer's, in autism, all the neurological disorder and ketogenic diet, also in morbid obese patients. So yes, that's a very wide area. And the ketogenic diet, what actually runs in the market, I mean, those are really, really not good. Those are really, really not good. And those are completely, hoax. I mean, I really need to speak about this. So I'm very happy that you invited me, doctor. Detoxification is another topic. We can all, of course, take it up. So yes,
Perfect.
Thank you.
Thank you very much. Thank you for being here. And
Thank you. Thanks a lot. Thanks, doctor. Thank you. Bye.